Hello, this is Dr. Charles Nemeroff, Chair of the Department of Psychiatry at the Emory University School of Medicine in Atlanta, Georgia. And today we're going to be talking about why patients with depression are at risk for cardiovascular disease. As we've discussed previously, patients with depression are at risk for developing coronary artery disease. And in addition, once such patients have coronary artery disease, either unstable angina or have suffered from a myocardial infarction, they are more likely to have a poor outcome in terms of cardiovascular death. And the question that we're going to discuss today is, why would this be the case? So there are several mutually non-exclusive theories to suggest that there are underlying pathophysiological mechanisms that would in fact underlie this remarkable phenomenon. The first theory that has been posited by a number of research groups, including our own, is the fact that patients with depression have a fundamental abnormality in their platelet-clotting cascade. A large number of studies, done not only by our group and published in the American Journal of Psychiatry, but by others, including Bruce Pollack's group at the University of Toronto, Mitch Finkel at the University of West Virginia, and a number of others, have shown that depressed patients essentially have a clotting diathesis. That is, they are more likely to form a thrombus than non-depressed patients, equally matched in terms of gender and age and other cardiovascular risk factors. For example, the very first step in the clotting cascade is platelet activation, and depressed patients are more likely, in fact, to activate their platelets than are non-depressed patients. And indeed, this is the rate-limiting step in thrombus formation. In addition, a number of other abnormalities have been discovered in the platelets of depressed patients. They're more likely, for example, to show calcium influx in response to various stimuli, and calcium is essential for the so-called platelet release phenomenon. In fact, patients treated for depression with aspirin still show abnormalities in platelet function, pushing them towards thrombus formation. In fact, they show elevations in two such measures, platelet factor 4 and beta thromboglobulin. And the final step in clot formation is, of course, the conversion of fibrinogen to fibrin. But the step before that is the conversion of prothrombin to thrombin, and again, depressed patients have been shown to be more likely to go forward in increasing thrombin production at a high rate compared to non-depressed patients. Two other theories have been suggested to be contributing to the risk of myocardial infarction in depressed patients. One is related to immune function. We know that depressed patients are relatively in an inflammatory state. What I mean by that is they show elevations of a number of inflammatory cytokines in plasma. These include tumor necrosis factor, C-reactive peptide, which is a risk factor for the development of MI and is supported by the American Heart Association as such a factor, and others, including interleukin-6. In a variety of studies, depressed patients show higher levels of all of these inflammatory markers. This inflammation is thought to contribute to abnormalities in the vessel wall and to contribute to an increased risk of thrombus formation. Third is the notion that there is a central nervous system abnormality in depressed patients that alters the ability of the brain to control the heart. And as many of you know, there is a measure of that ability called heart rate variability, and it's a measure of the heart's control by the central nervous system. Depressed patients at baseline have reduced heart rate variability, and that has been shown by the cardiologists at Columbia, led by Tom Bigger, to be a very significant risk factor for developing myocardial infarction. The good news is that treatment with certain antidepressants, particularly the SSRIs, reverse, at least to some extent, the platelet abnormalities and the decreases in heart rate variability. It's important for all of us to remember that depressed patients are an at-risk group for myocardial infarction, and they need to be treated as such and monitored carefully. This is Dr. Charles Nemeroff at Emory University. Thank you for joining me today.